Hi guys, so now we have the challenging NCLEX style PEDJA question. Okay, so the question is, a 6-month-old infant is brought to the emergency department with fever, irritability, poor feeding, and bulging anterior fontanelle. So the nurse suspect meningitis. Which action should the nurse perform first? Option A. Administer the prescribed IV antibiotic. B. Initiate seizure precaution. C. Obtain a lumbar puncture sample. D. Assess the infant respiratory and neurologic status. Okay, guys, so try to answer the question and put your answer on the comment section. Okay, guys, so let's break this down, the option. So first, the correct answer is D. Assess the infant respiratory and neurologic status. So let's break down the rationale. Okay, so in NCLEX, when you see signs like bulging fontanelle, fever, irritability, and poor feeding in a baby or in an infant, your mind should go straight to meningitis. This is a medical emergency in the infant, right? But here's where you apply prioritization. What comes first? Why D is the correct answer? So you always assess before you act. So before you to start procedure and give medication, you need to get a baseline assessment, especially with neurologic or respiratory compromise in infant. And then meningitis can lead to increased ICP and seizure or respiratory distress. So you must check the ABC, airway, breathing, and circulations. And then if the infant is crashing, so you don't want to miss it, and then you have to prioritize safety first. Go over the incorrect choices. Okay, so A, administer the prescribed IV antibiotic. So very tempting, right? And even me, I'll just choose this answer. But meningitis does require immediate antibiotic, but you never give antibiotic before a lumbar puncture because it can affect the culture result, right? So plus you don't just to jump to meds, but you have to assess first. And then also you have to remember the NCLEX. Love the assess before implement principle. Okay, so letter B, initiate seizure precautions. So yeah, this is very important. But again, this is not your first action. So you do this after you assess and determine the infant is at risk for seizure. And then you can prioritize something until you know the child's baseline. So you have to think like assessment leads to informed action. C, obtain a lumbar puncture sample. Yes, this is a critical diagnostic step for meningitis. But before you do an invasive procedure, you must check for a sign of increased ICP because if you skip this and the pressure is high, performing a lumbar puncture could lead to brain herniation. So you always assess your status first. So our takeaway for this question, when you're in doubt, so you have to assess first, especially with babies who can tell you what's wrong, right? So prioritize safety, ABC, and neuro status. Then only then you can safely move forward with meds or procedure.